Dr. Beyrer, how do you get your arms around the ethics and the constitutionality of releasing inmates and, having them not put themselves and other people at risk of a virus that's already broken out in a prison?
Well, I think the first thing to say is you have to remember that the United States incarcerates more people than any other country in the world, about 2.3 million people in our jails and prisons, many of whom are there for what are essentially administrative charges, parole violations, unpaid fees, unpaid fines, and so forth. There may never be a justification for using incarceration as a way to manage those persons, but certainly in the face of a pandemic like COVID, it's totally unjustifiable because prisons, jails, detention facilities are known to be extremely high risk for transmission, acquisition of respiratory viruses and other infectious diseases. And that's not just the inmates. That's also the staff, the people who come in and out of prisons. And of course, most prisons and jails and detention centers have 3 8-hour shifts a day. So there's constant motion between these facilities and the community from which workers come. So we're concerned about everybody in that dynamic, including the family members, co-workers of people working in and out of jails. And so I think there's very good justification for saying that people there for administrative detention, for example, who do not pose a threat to public security, should not be in these very high-risk environments.
So, Dr. Beyrer, who is the ultimate authority here then, when you consider that many of these institutions are privately run? Who has the authority to say you must release any patient that is sick or has been, in proximity with somebody who may have the virus, whether it be an inmate, a staff member, or otherwise?
Mm-hmm. We're not just talking about people who may have an exposure or who are at risk. We're talking about reducing the prison population because overcrowding and density is such a risk for COVID outbreaks. So let me just make that point very clear. But certainly in the U.S., it's a patchwork. So, for example, there are 37,000 people in immigration detention under ICE. They have absolute discretion to release those people. And those facilities we're very concerned about because they are very dense, they're very overcrowded, they have hygiene problems, and they have already had problems, for example, managing severe complications of influenza last year before this was even a problem. So ICE has that discretion. You alluded to William Barr. Of course, that is federal, and at the federal level, federal prisoners are under federal discretion. But many, many jails and state penitentiaries, but particularly jails, are run by counties and run by sheriffs. Many of them are indeed for-profit, or at least are managed by the counties or for-profit companies. And again, this is where the majority of people who are being held on administrative charges, things like parole violations, are being detained. And so it is really up to the discretion at the local level to get those people out of jail. And by the way, not to put more people in jail right now during this crisis for administrative reasons, for unpaid fees or fines. Unfortunately, in many of these smaller jurisdictions, this is a way that these counties generate revenue, but this is a moment for us to really reconsider whether that is ever in support of human rights, social justice, or indeed public protection, which is what it's done in the name of. But right now, in the midst of this pandemic, nobody should be going to jail for unpaid fees or fines or for administrative parole violations. We need to reduce the numbers of people in detention to prevent really catastrophic outbreaks inside, which unfortunately we saw in Wuhan and which is underway right now in New York at Rikers Island.
How do you avoid this becoming a partisan issue? And I imagine that it's very different when, if you're talking about jails as opposed to ICE detention centers or the border, for example.
Yes. Well, what you'd like to think is that in a public health emergency like this, everybody is concerned. We all have to do what we can. And protecting the people whose liberty we have taken away is a fundamental justice issue, I think, that crosses the aisle. It is in nobody's interest to have large-scale prison outbreaks. We have to remember that these people, particularly in rural areas, and it's particularly true for the ICE detention facilities, many of which are in quite remote rural areas, the people who progress and get really sick with COVID disease need intensive care, as we know, and many of them end up needing very intensive care like respirators and so forth. These counties are unprepared for what would happen if they had surges of patients from these facilities. So I think that has the potential to really be an issue that goes across the aisle. And, of course, William Barr is already on record as saying that the Fed is going to do this. The ICE detention issues, there already are hunger strikes and protests underway. That may be the most politicized of all of these issues. But we should remember that until relatively recently, people were not detained, asylum seekers were not detained unless they had a criminal record at all in the United States. We really only need to go back to the policy of several years ago where people get a court date and are released if they have family members.
Yes.